Hello, this is Dr. Samira Khan. I'm conducting MRCPI OSCE courses and MRCOG Part 2 and Part 3 courses since long time, since 5 years now. And many of my candidates passed the exam. The passing rate is for MRCPI OSCE is like more than 90%, alhamdulillah. And one of my, what you call it, my friend, my best friend, and my student also, she passed MRCPI OSCE and MRCOG Part 2 and Part 3. And throughout all this journey, I was with her. So she knows how am I and how am I teaching. And also she has all the experience of MRCPI also and MRCOG. She has gone through all the steps. So I thought that maybe it might be helpful for all of you and to get benefit from her experience. Today, I'm talking about MRCPI OSCE. So Dr. Sabias Siddiqui, Assalamu alaikum.
Walaikum salam, Samira.
So Sabiha, the first question that I want to ask that you have gone through MRCPI. In which year you passed the exam?
I passed MRCPI in November 2021, last year. After because I have I passed my written in 2018, and after that same year I did not get the seat. But after then the COVID came, and because of the COVID my OSCE delayed. But immediately after the COVID I got the seat, and I went through the exam, and alhamdulillah I passed in my first attempt.
First attempt, yes, I know that. That is great, actually. And for the people, to encourage other people, tell them that MRCPI OSCE, there are many people who can pass from the first attempt. I'm talking about OSCE, like I passed from the first attempt also. It's just a matter of few things that you need to know, and these short courses will really help you. Yeah, if you are talking about the theory, for the theory, yes, you need to study, and maybe you need like few months to prepare. Maybe you need a course, like a long course. But for the OSCE, I think a short course of 4 weeks that should be enough, like a total of 8 classes in which you can 8 to 10 classes in which you can cover all the modules should be enough, right, in order to pass the exam. The passing rate in my groups was always more than 90%. So this is encouraging for the newcomers, isn't it?
Yeah, you are right, Samira. MRCPI OSCE, actually MRCPI written, you might need to do some more theoretical study, and you have to get the knowledge, theoretical knowledge more, and you have to recalls little more. But in MRCPI OSCE, I would say it's this examine your approach, how you approach to the patients, and they are very gentle, and they are very nice examiners from MRCPI OSCE. They just want to see that how professional you are.
Yeah, that's true.
And how caring and how professional.
I really like the examiners. They are so gentle and nice. So, I mean, in comparison. So they are nice people.
Yeah, I agree.
So no need to be afraid of anything. Just they need your applied knowledge, and they need to see that if you have the basic skills or not. So they are usually concentrating on basic things.
Yes, on basic thing and basic approach and professional approach from the start.
So I want to ask you, once you arrive, you register yourself in the OSCE, you paid for the exam, and then now you are in Dublin too, right? So is it in the building, the exam is in the building of Royal College of Physicians of Ireland?
Actually, my exam was in Dubai.
Oh, you went to Dubai.
But what I heard about the Dublin also, because my friend, they got their exam in Dublin. So what I heard from those of my friends, that they have OSCE first in one center, all gathered together, and they did the OSCE like seven stations. Yes, and after that they are assigned. After that 7 stations, they all assign to 2 or 3 hospitals, I think. And they all the candidates, they already knew that where they have to go for their long cases. Then after the OSCE, there is a small break, maybe 1 hour, I think, or 2 hours. After in which time they have to take their tea or coffee, and after that they have to take their things and they have to reach their destined hospitals where they have
You
to
mean
go through
the
a
long
long case.
cases are still in hospitals? Because
I'm talking about when it was in hospitals.
yeah, this one we did it.
But,
like I passed my exam a long time ago, 2012, and this is what we did. We finished our exam in the building.
Yes.
Yeah, in the building of Royal College, the OSCE, once it finished, they gave us like 2 hours break. I think 2 or 3 hours break, and then after we had something like coffee or a little snack, then we went to one of the hospital, like Rotunda Hospital or whatever, and there we had our long case on real patient. But nowadays they are having the like simulated cases. So tell me about it. What happened in Dubai?
Yeah, I had the simulated yani dummy patients because since the COVID, but I don't know what in the coming year, in this year, what their approach will be. But what I did, we were assigned, all the candidates were assigned in the same hospital. It was a hospital. It was they arranged 2-3 rooms. They registered us. And we kept all our bags and everything outside. We went inside. We were waiting. After the registration, they asked us to wait. And after that, they start first the OSCE, like 7 short stations.
Okay.
So they made 2 groups. They run first group first, and the second group second again. After that, then we started from the OSCE 7 stations. Only 1 station was the role player stations. Remaining all are the examiner stations.
So is it usual or that one station is role player? I mean, is it their usual?
Actually, the stations, most of the stations, they were recall stations.
Okay.
Okay. And one now what they send us in the instructions that our long case also, yani it can be role player stations, and it can be examiners ask questions, yani.
Okay.
No? So my long case was a role player station, even in the long case. For that, I was not expecting. I don't know why I didn't think about that. I might get a role player station in the long case. I was thinking that my long case will be to take the history, then to examine the dummy, and after that, it will be examiner who will ask the questions and take my viva.
So you mean this is usually what happened, that it is a role player, but you just go and take history from her. So it was really like a role player, like she asked questions and you need to counsel her?
Yes, it happens with me that I was not expecting that. I took the history, then they asked direct me towards it was almost 10 minutes. They give me 10 minutes to complete that full history. So there was 2 examiners sitting besides me, and there was a bed on which there was dummy.
So 10 minutes for the history.
Full history, yes, for the history.
Okay. Then
full history. After that, I asked them, I need to examine, because I was talking to the patient. I took all the history, and then I asked permission to examine the patient. Then the examiner direct me that there is a dummy on the bed, and you have to examine on the dummy. So I followed all the precautions, like to and scrub the hand, to clean the hand, showing just acting, it's sort of a most acting. But because you are doing it regularly, so your reflexes are already already matured. Your
It
reflexes
is
are already following.
inbuilt in you that you have to sanitize
Yeah,
your
you
hand
have to,
before you
yeah.
touch the patient. So
Sanitize, yeah. Sanitize and
automatically,
take permission, yes.
yes,
Take permission,
take
make a
permission.
position,
Yeah,
cover
make
the
position, cover
patient.
the patient, like,
Yes,
a few tricks
yes, yes.
that they
Yeah.
really like.
So I went to the patient beds and I start telling. I start telling because examiner was beside, so I start telling that I will examine the patient. I will see this
So
first.
this
I
is
will
what you did
general
in
physical.
dummy. We were a little bit confused that should you talk to the dummy or should you talk to the examiner?
Actually,
Remember
I know
we were
it was,
talking
yes,
about it.
I remember.
Yeah.
I remember before the exam, we were so confused,
Yes.
but I am telling you what I did.
Okay.
When I went to the dummy, I took dummy as a patient.
Okay.
I asked permission and I
Hmm.
explained that what I am doing with you. I
Hmm.
will start from general physical examination. I will take your
Mm-hmm.
temperature. I will take your blood pressure,
Okay,
or my
good.
nurse will take your blood pressure
I
and
think this
temperature.
is what we
I
discussed
will
that
check
this
your
should be
pulse.
done.
Yes,
Yeah.
yeah. Because I am telling I am telling each verbally
Hmm.
to so that the examiner will listen to me that what
Yeah.
I want to
So
do.
how many
Then I
examiners were there when you were with the
two
dummy?
examiner,
Two
two
examiners.
examiner were
Okay,
there.
this is what happened
Yeah.
always.
And
Okay.
I said I will check the sclera to
Hmm.
check whether she is pale, whether there is
Mm-hmm.
any jaundice, whether there is any. Then I will check her tongue to
Mm-hmm.
check that dehydration or the
Yes.
color of the tongue, whether it is pale. Or
Mm-hmm.
then I will check the nails. I will check her
Mm-hmm.
palms to
Mm-hmm.
rule out if she is pale looking or anemic. And
Mm-hmm.
after that, I will check her blood pressure and pulse and temperature, or I will ask my nurse to check these vitals.
Yeah.
Okay. And
So
after
after,
that, I will
yeah,
examine.
yes. Then after you introduced yourself and you took all the precautions and everything and you started examining the patient, so you were continuously talking to the patient and looking at her face like we
Yes.
practiced. Mm-hmm.
Yeah, yeah, yeah,
So
yeah.
you
I'm
were not
talking to the
talking to
patient.
the examiner, right?
No, I did that time. I was not talking to the examiner.
Okay,
I took
good.
a dummy as
As
she's
a
my
patient.
patient and as she's replying me.
Ah, okay. And it went well with you? I mean, they did not
Yeah,
object on it, right?
it was no. They did not object anything.
Mm.
At the end, I examined the parabdominal examination. I did parabdominal examination. They
Mm.
saw me how I am doing parabdominal examination. It was gynae patient. It
Okay.
was endometrial hyperplasia patient and
Mm.
endometrial cancer,
Okay.
postmenopausal bleeding. So the
Okay.
patient
Okay.
was having postmenopausal bleeding.
Mm.
So then I did the inspection, and while
Mm.
I'm doing inspection, I am just verbally telling everything that I'm doing inspection. I'm checking vulva and vagina whether there
Mm.
is any scar, any ulcer,
Mm.
any abnormal pigmentations,
Mm.
and estrogen, whether there is any sign of
Hypoestrogenic straight.
hypoestrogenism.
Yes.
And then I will do gentle perispeculum examination.
Mm-hmm.
Then if the pap smear is not taken, I can take the pap smear at the same time. Or if there is any abnormal areas on the cervix, we can take even the
You were
biopsy at the
supposed
same
to,
time.
okay, you were supposed to do the per speculum examination
Yes, I
practically, do you?
supposed to do. They give me. Some of the girls they said there was no speculum, but for me, when I say I have to do
Mm.
the perispeculum examination, then
They gave you.
they direct me that there is a speculum. There was a plastic speculum, I think,
Mm-hmm.
for
Mm-hmm.
one use
Disposable
only,
one, yes.
that disposable one. So I
Mm.
lubricate. I said I will lubricate it, and
Mm.
then I will insert longitudinally. I show them how to insert.
Okay,
Okay.
so I think
So
they
I
wanted
am
to see
verbally,
how
I am,
you are
yeah,
inserting it.
yes.
Yes.
I'm saying, then I say, I will see, I will check the cervix. Then if there is any abnormal discharge, I will take the swab for culture and sensitivity. If there is any abnormal area in the cervix,
Mm.
I can take the biopsy or pap smear.
So,
If the pipal is, I forget to take the biopsy that time, pap smear that time. But when I sit,
but you said initially.
no, I didn't say initially. When I
Okay.
sit, I asked them, perhaps I need to be taken. So she said, examiner said, why you didn't take?
So
I
it
said,
means
if,
that they have you mean
but they asked
the
me,
cytology brush
yes,
with them?
yeah, I told them, if it is available, I can I can do the biopsy. Even pipal biopsy, she asked me, can you take pipal biopsies here? I said, yes, if it is available, I can take it. We used to do it in our clinic.
Yeah.
So
So
she just wanted to hear me.
it was there, or you just wanted to hear from you?
No, they just wanted to hear me. I told them, If it is available, the clinic have the facility. There's available pipal biopsy. We can take it.
Okay. So
I told
basically, they looked at how you are inserting and removing the speculum,
speculum and
verbally,
what you know,
and your knowledge. That's it, right?
your knowledge. Yeah.
The skill they were judging was how to insert and remove the speculum gently, the way. Yeah?
Yes.
And the knowledge is what you will do. You were talking to them, you were communicating to them. Initially,
Yes.
you were talking to the patient, and then when the examination part comes, I mean, like you were
An
talking to the
examination
dummy
finishes.
like a patient, and when the examination part comes, then you started talking to the examiner. This is what I understand.
Examination, during all the examination, I was talking to the patient. I was when I examine, when I do bimanual palpation, I check on the face of the patient. I do bimanual. I took
But
check the size
understood
of the,
from you
just
that
acting.
you were talking to the patient and to the examiner while you were examining, because you were explaining
while examining, I was talking to the patient. Okay, but I am telling verbally everything. I'm checking now this. Yeah, I just want to verbalize the thing.
In your medical term also, you were telling not the patient, actually this is for the examiner to know that what you are doing. Yes,
what you are doing.
Yes.
When
so
I finish the examination, then they ask me, come and sit now, direct towards us.
So total examination for how many minutes?
Maybe I think I took maybe 3 minutes or 4 minutes.
So you can say 5 minutes. So 10 minutes for
the examination was 10 minutes is remaining now.
10 minutes for the history, 5 minutes for the examination, and how many minutes left then?
Then 10 minutes remaining.
10 minutes total for the viva with the examiner. Okay, now this is the viva. We will see each and every case how they are doing it, because what we are doing in our course, we are doing, that we are only doing recalls, because the exam is usually coming from the recalls. More than 90%, you can say.
Yeah, more than 90%. I must say it was like 97, 98% from the recalls.
Oh yeah, you see. So it's very rare, and if you are not, and you can even do it if it is not coming from the recalls.
It's a doable exam if you are practicing, and if you are working, it's a quite approachable or doable exam.
Yes, it's practical, and you can still pass the exam even if this is the first time that you are encountering that long case station. So it's okay. So I want to ask you, 7 out of 7, there is one role player. After each role player and after each examiner viva, are you getting like 2 minutes to make your bullet points? Is it like 2 minutes before and then 10 minutes station?
Actually, in OSCE, we reach to the station, and the examiner is sitting, and there is a table. On the table, there is the station, written station is there.
Okay.
And then the examiner give us, or maybe 1 minute only, that just read your stations.
1 minute?
And let us know. Maybe 1 minute. And there is no paper, nothing. You don't need to write and make a bullet point or something. Just in your mind, actually. What you can make in your mind. And then they say, when you are ready, just start. So you read your stations. Then you make your mind in your mind, how it will start.
So you are not supposed to have a notebook or something with you?
No, we are not supposed to take anything on the station with us.
Oh, so
there is a plain paper.
So you enter
there is a
the
plain
station.
Paper. Yes, there is a plain paper. There is a plain paper, and there is a pen also. They said if you want to write something, you can write or calculate or something. Maybe 1 minute they are giving us.
1 minute only before every.
1 minute.
And this 1 minute is in front of the examiner, right? In front of the
examiner. Yeah, examiner is in front of us. It's not like station is written outside and you are making bullet point. It's not like MRCOG. Okay. Examiner is sitting with you. You enter into the station. You sit in front of the examiner. There is a station in front of you. Then after maybe 1 minute or something, the bell rings. Then the examiner say, if you want to read it, you want to make some plan in your mind. So take your time. It's up to you, because 10 minutes is yours. Bell already rang.
So it
If you
means
take
it's
more
total
time,
1 minute, including that 1 minute that you are supposed to
it's up
take.
to you, Samira. Whatever station is there, if you want to make a plan, examiner will not tell you that don't take this time. You want to take time, take
So
two minutes,
it's
3 minutes.
not 12
Examiner is
minutes like
right.
MRCOG.
No,
MRCOG
no,
is
no,
giving you 12 minutes,
no,
2
no,
minutes
it's not
for
12
bullet
minutes.
points and 10 minutes for in front of the examiner. It's
No, it's not.
total 10 minutes, and you
No,
have to
it's
use your 10 minutes, like 1 or 2 minutes, whatever you will take, and then rest of the 8 or 9 minutes to talk to the examiner, isn't it?
yes. Actually, MRCOG is a very organized exam, and they are doing audit. They are calculating each and every minutes. But MRCPI is not that much complicated. There are simple stations, examiner sitting, bell rang, go inside, sit with the examiner. If you, examiner will ask you, take your time, read it and plan in your mind. If you are ready, just let me know. So you have to read it, then you will plan in your mind, then you will ask the examiner, yes, I'm ready, I want to discuss now.
Yeah.
So you want to take 1 minute, you want to take 2 minutes.
This
It's
is
your time.
exactly what happened with me in 2012. So they have not changed anything, it means.
Actually, Samira, they have certain question to pass you that station. If you take more time to plan, to make a bullet point, or you are confused for something,
it is your
it's
negative.
your time. Yeah, it is your time. Yeah.
But by the way, they don't take it as positive if you're taking too long. So they want you to start actually after 1 minute, they will become impatient.
They want to start. Yeah.
They want
say,
you
no,
to
the
start.
examiner simply saying your time is lacking. Doctor, can we start?
Yes.
You are losing your time.
Yeah.
They are very, they came as, initially we were very disappointed, but we feel that they came to pass us actually.
Yeah. Their
They
intention is to pass.
yeah,
Unless
to pass.
you don't want to.
Unless you are very,
confused.
Unless you are very confused and you are total mess.
Yeah.
Otherwise,
one thing, one
pass.
word you said, for because of this, I have seen many students not passing the exam. Although they are very perfect and they know all the steps, their knowledge, I must say, very, very good, you know. If you are confident, you know, whatever you are saying, then there is a great chance that you will pass the exam. So if you are confused, they will think that you are not that experienced, or you are not doing it on regular basis. That's why you are confused. So don't show them that you are anxious, even if you are and you are confused, but be confident for whatever you said. It maybe they're asking you about the steps of vaginal hysterectomy, and you told them 70% maybe of the steps, and you forgot like few points, which maybe, or you said 80% and you forgot 20%. There is a chance that still you can pass the station if you are confident what you are saying. Yeah.
Actually, Samira, I would say, you know me, I was with you throughout this journey of my exam, part 2 exam, part 3, then MRCPI. And you know me, I am sort of a person, I am not making notes. I am not very good at rectification. Like I do remember each and every point. I am not that person. But of course, I am practicing, I am working, and I am very confident about that things. So whenever I forget the things, I clearly say I forget it. I know it, but this time I forget. Believe me, some words, very common words, they did not come on my tongue at that moment.
Yeah,
but
it happened to me also.
I clearly told the examiner, I know that, but this time it's not coming on my mind.
Yeah, this is exactly what happened to me, that there were very, very common things, and it was so silly that I forgot. But I told them that I'm sorry, what can I do? I cannot remember it now. They were helping me to remember, but sometimes few points, I think, in my long case that I didn't remember, and I said that I'm sorry, I can't remember it now. So they don't mind. But usually in long case, I realize that they want like more than 80% of their questions to be answered,
Yes.
especially in long case. Yeah. Otherwise, in short cases, if you are telling them the steps of hysterectomy, for example, and I told them, believe me, only 70%. The rest of the things, I came back, I said, oh my God, I have written it step by step, and I forget to tell them this and this and this. So I told them only 70%, but still, it's so kind of them that they don't mind, and they can, they are there to pass you, as you said. They are not there to fail you.
Yes.
But unless you have done blunders, this is
Blunders and
something
you've
else.
done a mess, total mess, or you are
Total
too much
mass is
confused.
something else, yes. So this
Then
is
on.
what we will do in our course, that we will try, we will practice with the students so they become confident, and that even if they don't remember something, what they have to do, there are certain common things, certain common tricks actually, that works, and it always works. And of course, there is knowledge, but not everyone who has knowledge can pass the exam. This is what I want to say, that there are certain tricks that you have to be confident in short cases, for example, and tell them what you are doing practically, what I must say, not that what you remember. At that time, you might forget, but what you are doing practically, it will come automatically to your mind. And they are very smart people.
Very
they
simple,
they will
Samira.
simple and smart, they will recognize that you have been doing it, and you know, even if you told them like 70%, but they will still consider it, they will not fail you. And in long case, what I realize that like there are few tricks, they want basic knowledge, and they want like more than 80% of their questions to be answered in that 10 minutes. And then they want you to take history. This is very surprising that you the role player was dealing with you like a short case role player, and you needed to counsel her, right?
Yes. It happens with me actually. When the examiner finishes her question, the examiner asks the role player, now it's your turn, you have to ask the question. Then
Yeah.
she was asking me what will be my treatment,
Hmm.
how I will manage, and where she will live, whether she will
Uh,
get the complete
and you were
treatment.
supposed to
Like,
answer counsel,
yeah,
right?
I have to counsel her because she's
Hmm.
asking, what is hyperplasia? You said, what is
Okay.
this hyperplasia? So in patient language,
But it's
I
okay
explained to her.
because we practice a lot role player stations. So even if she asks, it doesn't matter, right? You were ready for everything,
Yes, I was
whatever.
ready. That's why I explained in her language what
Yes.
is hyperplasia.
Yeah. So thank you very much. I'll not take much of your time. These are some of the basic questions uh, that students used to ask me. And that's why I ask you all these questions. And I passed my exam like long back, and you just passed the exam. So I thought that it might help the other newcomers, especially who have not, especially in COVID situation, how it will be. And then, but for the, if they will start the real patient for the long case, it's okay. I know how they are doing it. They are usually not changing their approach. If they are doing it for a long time, they will continue doing the same thing. Like they like to have their repeated stations, they will continue doing the repeated. So they are not changing a lot of what you call it, the basic structure, the basic format. They usually like to keep that format. And the way that they are, like two examiners will come for the long case, it's since long time, many years, they are doing the same thing. So their approach is basically the same. Yeah.
Actually, Samira, I would say not only RCPI, MRCOG also they also not changing.
Hmm.
They what I got the station in my MRCOG also, they
Hmm.
all are the recall stations.
Oh, all of them.
Actually, all of them. Maybe one is not one or two, otherwise all.
So this is for the people who are going for both, like me and like you.
Yes.
They went for both MRCPI and then after that MRCOG. So it helps them a lot. It's a kind of relief for them that we can discuss all these recalls and then it will come. So it will not be a surprise.
Yes. Just be confident what you learn, what you are doing in your clinic. Because if we sort of make a template and we stuck on the template, and if we don't listen to the patient, this gives
I
this
have
will go
seen some of the students,
negative.
they stuck on the template and it looks so theoretical. It's not practical approach, that the people that I knew, that they were stuck to the template and they just wanted to follow the steps after step. They did not pass the exam.
Yes, that is not done by me actually.
Yeah. So
I did not
people are
remember
really
any
very
template.
anxious about template. They want to follow the template, but this
People
is not
are
the way of passing. Yeah.
so anxious about the template. If there are 2 or 3 stations, they don't have template. They are searching here and there. The template somewhere they want to get that template.
Yeah,
That
the
we will
format,
get the template.
the template,
Format.
but there was no time to follow any template over there. You will become totally lost, and you will just do what you have been doing in your clinic and practically in your OR.
And if you talk more, this is your negative point. So allow your patient to talk more and be intelligently.
Yes.
Let the patient talk what you want to listen.
Yes, yes. So direct her what you want from her.
But what
like
I
what
feel,
we are doing in role player discussions.
Yes, I was so anxious about the exam, like all the candidates.
Yes.
But I found all the role player, even in MRCOG Part 3, they are so helpful. They're trying to direct you.
Yes, the role players were trying in Part 3 MRCOG. My role players, I didn't pass from the first attempt, but believe me, they did they put all their effort in directing me. It was my fault that I was not able to reach there, but they were directing me. The role players were directing me. So the concept that they have their list and they are not passing the overseas Canada. No, that is all not true. So
they are so nice. Helping. They are directing me. They are directing, and it's your confusion. It's your anxiety that fails you maybe.
Yes.
Otherwise, we call these stations, and the nice role players, they are directing you, examiners, they are directing you. Yes. Believe me, whatever I did mistake, it's my mistake. Otherwise, the role player examiner,
they did everything to direct you.
Yeah, they are directing that. What is this? Yeah, it's me. If I did.
It's so encouraging. But some people used to say that no, they have their certain criteria. The overseas, no, that's not true at all. If you fail, it's you. It's not them.
You're right. And I passed my all domains, even though after the exam, I'm thinking, oh my God, I did this mistake. This is a very silly mistake. Why I didn't hear the role player? She was directing me and I did not notice.
Yeah. You have to pay attention to their, what you call it, their directions, or like they are pinpointing something. You have to listen.
To the patient.
Yeah, pay attention. Yes, what they want to say. Yeah. So thank you very much, Samira, for your time, and thanks a lot. I'll come back to you for taking advices for MRCOG Part 2 and Part 3 also, because we were together in the journey, and I know that you were very thorough and you know all the steps. You recently passed the exam. So we'll come back with another video, because this will be very long if you will do it together. So for that time, thank you very much. Thank you. Thanks a lot, and congratulations.
Thank you very much. Thank you very much. Samira, you were with me all the time. You are very gentle. You remain, and you help me a lot actually. Whatever I have to practice, I ask Samira, please do it with me, and you did it with me. And as an examiner, I was not hesitating talking in front of you. That gives me
some people are telling me, apart from you also, that we are not hesitating, but this is why we are here. I mean, you should not hesitate while you are in a course and you are talking to me. So
no, Samira, there are some course there are some of the mentors, they are conducting the courses. Even they are just horses, but we are hesitating because of their maybe tone, their maybe attitude, frankly speaking. So not all the mentors you are very much confident, or you are very much what you call comfortable. So
comfortable
I
to talk
think
to.
most of the candidates, they are comfortable in front of you because your tone is very nice, your attitude is very nice, your behavior is not if we do mistake, it's your behavior is just to teach us, to correct us.
Yes, this is
In a
exactly
very
what we
good way.
are here for.
Friendly actually.
Friendly,
Not
yes.
insulting that why you don't know this thing, you should know, this is very
common. This is common sense, or this is you are supposed to know.
Some of the mentors, they are doing it actually.
Yeah, there's nothing that you are supposed to know. You will learn with, you know everything, Samira. You know better than me. Believe me, I have students who are like, they are more experienced than me, and they are professors, and I'm very much ashamed to teach, but it's just the tricks that we know it. And like you pass the exam, you can start teaching right away, right? So you might be much better than me, so I just know some tricks, so I'm just helping them. So that's fine. So anyway, thank you very much, Sabia. See you.
You are most welcome. You are most welcome. If you want me anytime in your class, or recalls anything, anybody
I
wants,
might call you to come and help. Thank you very much. Thanks a lot. Thanks a lot, Sabia. Thanks a lot. See you.
You're welcome.